By now, you have a basic understanding of what's involved with total joint replacement. So let's take a few minutes to focus on the exercise program for knee surgery patients like you.
Hello, my name is Don, and this is Tim. We'd like to demonstrate the exercises you'll be doing after your total knee replacement. Doing the proper exercises after your surgery is critical for getting your range of motion back and also developing the strength of the leg. If you're watching this video before your surgery, it's a good idea to practice these exercises ahead of time. You'll be doing 10 repetitions for each exercise twice per day. We recommend that you take your pain meds about 30 to 60 minutes prior to doing your exercises. This will help make the exercises more comfortable and will allow you to make faster progress. Also, go ahead and walk around to warm up. If you have a remote control, you may want to pause the video after an exercise is demonstrated. Do your 10 reps, then restart the video to continue with the next exercise. You can also follow along in the knee book under the PT section. Let's start with the exercises you'll be doing lying on your back. These can be done on a bed or couch. There's no need to try to get down on the floor to do these. Starting as soon as you wake up from surgery, you'll be asked to do ankle pumps and circles about every 30 to 60 minutes you are awake. This helps with your leg circulation and helps prevent blood clots. Be sure to pull your foot way back to stretch the calf muscle, then way down. You can also make big circles with your toes. Do about 10 repetitions of pumps and circles. The first exercise in your book is called a quad set because it works your quadriceps muscle, which is the main muscle of your knee. This is a great exercise to work on prior to surgery. Press the back of your knee down into the bed. This will tighten up the quadriceps muscle of your thigh. You should see your kneecap move up when you do this. The idea is to press the back of your knee down into the bed, not your heel. Try to hold it for about 5 seconds. You can count 1001, 1002, 1003, 1004, 1005, then relax. This will stretch the back of the knee. This is an extremely important exercise. After surgery, it should be done every hour you are awake, 5 to 10 reps. Many of you will be asked to use a single towel roll placed underneath your heel. This provides for a better stretch of the back of your knee. The next exercise is a prolonged knee extension stretch. Some of you with limited extension will be asked to use a large roll, about 3 towels, for this exercise. Place the roll underneath your heel and simply let your leg relax. This allows gravity to give the back of the knee a gentle stretch. Keep your kneecap pointed up. Don't let your leg roll in or out. If this gets uncomfortable, you may move your leg occasionally to bend it a little, but then let it relax and stretch again. The idea is to gradually build yourself up to about 5 to 10 minutes of total time. You may need help with placing the roll and removing it. Next is the heel slide. For this exercise, try to bend your surgical knee as best you can by sliding your heel back towards you. Then let it down slowly. First, you may not be able to do very much. Just do whatever you can. Even a little movement can be helpful. There's no need for anyone to assist you with this. Next is the straight leg raise. Now bend the knee of your opposite leg up like this. This will support your low back. Tighten up the quad muscle, then try to lift your surgical leg about 12 inches off the bed, then lower it back down. Try to keep the knee as straight as possible. This will help strengthen the quad muscle. You may need help with this exercise for up to 1 week after surgery. Next is the short arc quad. Place a large towel roll underneath your surgical knee. Try to straighten your knee out by tightening up your quad muscle and raising your foot off the bed. Hold it as straight as you can for about 2 seconds, then let it down slowly. You may need help with this for a few days. Next, we'll be doing exercises in a chair. Try to use a kitchen or dining room type chair, something with a firm seat. Next is a stretch using your opposite leg. Sit toward the front of the chair. Be sure your foot can slide on the floor. Wear stocking feet or place a towel or pillowcase on the floor. Then put your opposite leg over the top of your surgical leg and use your opposite leg to slowly bend the surgical knee. Come back slowly to the point of a fairly good stretch. Hold this for a count of 5, 1001, 1002, 1003, 1004, 1005. Then relax, slide your foot out. As you repeat this, try to go slightly farther each time. Don't bounce or overstretch. It's important to go slow and controlled. Also, try not to lift your hip up off the chair. If you have both knees replaced at the same time, this is the one exercise that you won't be able to do. Next is the long arc quad. While seated back in a chair with your thigh supported on the chair, straighten your knee out by tightening your quad muscle and lifting your foot up. Try to straighten your knee as best you can, hold it about 2 seconds and then let it down slowly. You may need assistance with this for the first few days. Next is the stretch by scooting forward. For this exercise, it works best if your foot does not slide too well, either barefoot or use a good fitting slipper. Slide your surgical leg backward as far as you can on its own. Then, slowly scoot your hips forward while leaving your foot in one place, causing a light stretch. Try to hold this for about 10 to 15 seconds. As you hold it, the pulling should ease up. Then try to scoot just a little more to get your knee bending a little further. Again, hold it about 10 to 15 seconds. Continue in this manner for about 2 minutes total, then relax, scoot back. Repeat that entire sequence 2 more times. You may want to apply an ice pack to your knee after you are done. This can help with the pain and the swelling. Always have a layer of clothing or towel between your skin and the ice pack. Apply it for about 20 minutes. It's important that you're able to discipline yourself to do these exercises twice a day. Perhaps your coach can help you stick to a routine. Try to set up a regular routine, taking your pain medicine 30 to 60 minutes before you do them. Also, try to change your position during the day. It's good to spend some time with your leg out straight or extended, and sometimes sitting up with your knee bent or flexed. As your knee improves, try to use it more. For example, bend your knee and use that leg when getting up and down from sitting. Walking is also a great exercise. This means household walking for the first 1 to 2 weeks, then gradually progressing as you're able to. Recovering from a knee replacement can be a big challenge, but we expect your hard work to pay off. We wish you well in your recovery.
Although you'll be doing lots of exercises after surgery, it's important that you consult with your physician before resuming sports or other activities.